Welcome everybody. Today is a cool day in Toronto. Okay, we're like hitting minus 20 degrees, and I figured I'd wear my a vest here just to warm me up while I'm thinking about dental pain. Been bugging me all day. I was wondering if there's still remnants of my tooth decay. I had a cavity 2 weeks ago where I went to the dentist. Just went for a regular checkup. You know, I brush my teeth twice a day. My flosser, not really, but I think I pride myself into, taking care of my dental health. But unfortunately, missed a spot back of my, basically of my wisdom tooth. Dentist saw a cavity, so it was okay, bud. It's your wisdom tooth, so we can take it out, one option, or we can drill a hole and just take care of the cavity. I went with, let's drill a hole, doctor. I've had my wisdom tooth, a couple of them pop up, a few of many years ago, and it was not a pleasant experience. So there you go. Numbed me all the way. It was numb for about 2 hours. I don't know what he did, but I really felt it all the way up the back of my ears for a few hours, and but took care of it. He was actually surprised because it's so deep, and he was like, "How come you didn't feel any pain from this?" I'm like, "I don't know, doc. I guess I am a very high threshold for pain, but not today." So I was like, "Okay, gotta figure out a way to see him again." Not the easiest guy to see. He's been in business for a long time, so his hours are a little shortened. I'm sure a lot of you have the same kind of problem. Always when you need a dentist, set the appointment up. So what do you do in the meantime, right? A lot of them are not available emergencies, so to treat the pain is what we try to figure out today, in a way that's more accessible to everybody. Small tips. Always talking about the cold compresses, and I think cold compresses is something that we can always have access to. We're talking about it helps to decrease the pain and the swelling. They recommend, of course, putting ice in the towel, soft cold pack, or bag of frozen vegetables. You avoid putting ice directly on the skin because that's not good for the skin. It's pretty painful. You might put ice cubes directly on your skin, so not the recommendation that you have these days. And you apply the compresses 3 to 4 times a day. Should be enough. You recommend if you're gonna have to sleep through it, say prop up with a few pillows, helps reduce the pain. So probably the way the transmission of the nerve endings and all that doesn't transmit as well. That's my professional guess on that, why they would have that as a recommendation. And to say keep your mouth clean. Should have done that from the start. Even better. I thought I was really good at this, but salt and water always recommended for inflammation. Half a teaspoon of table salt and about 8 ounces of warm water. Just swish it around 15-30 seconds and spit it out. I mean, you could swallow it, but don't want gag. I remember going to the beach in Cancun and had a few of those and just end up gagging. So spit out your salty water. Do that. It's much better. And also, boy, the screen is bugging me here right now. Don't be surprised if your dentist tells you to try acetaminophen or ibuprofen. Typical recommendation, acetaminophen or Advil. The difference, everybody asks me about the difference. Think of Tylenol, good for pain and fever. Advil, ibuprofen, or Motrin is also an anti-inflammatory, so good for swelling. So in this case, I would go with the Advil as a recommendation, and make sure you take enough. Good dose for adults, 400 to 600 milligrams every 6 to 8 hours. That's the best. People tend to be a little bit squeamish about taking medication, but if you want it to work, take enough and don't come back and tell me it didn't work unless I hear you taking at least the 400 to 600 milligrams every 6 to 8 hours. And that's what I'm going to be doing to help me for the pain until I'm able to see him. And those are the best recommendations. Some people like to recommend also the Aura gel or adult or anything with benzocaine gel. Not really that effective. Temporary relief, not recommended for kids under 2. And clove oil is something that's still sold, but not likely to help with dental pain. So really not the recommendations that you would get with regards to that. So that's the recommendation on dental pain, guys. I am going to tackle all that for myself until I see him. I hope a little bit of these tips help you. Stay warm out there, Toronto. It is cold. I should just go out there and put my face in the cold snow, but again, I don't want to lose my face to frostbite. You take care, guys. Bye.